to ask the Scottish Government what action it is taking in response to recent reported analysis by Health Equals, which shows that poverty-driven health inequalities are reducing life expectancy amongst people who live in the most deprived areas.
Minister Marie Todd.
We are using all of the powers and resources available to us to tackle poverty, reduce inequality, increase healthy life expectancy and thus create a fairer Scotland. The Scottish Government has allocated almost £3 billion across 22 to 23 to mitigate the damage inflicted on households by the UK Government's cost of living crisis. We're providing free school meals, increasing the numbers of hours of free childcare. We've already increased the Scottish Child Payment to £25 per week, supported 1.85 million households with council tax reduction and uprated all benefits that we deliver. We'll continue to deliver free prescriptions, concessionary travel, free personal care and our Fair Work agenda.
Faisal Chowdhury.
I thank the Minister for that answer. As co-convener of the cross-party group on improving Scotland's health and as a member of the Social Justice and Social Security Committee, I'm well aware of the disparities faced in Scotland in terms of health. In 2018, a study showed that a boy born in Muirhouse had a life expectancy of 13 years shorter than that of a boy born in neighbouring Cramond. Analysis from the Health Foundation reported that the average life expectancy in Scotland has reduced by 4.4 years since 2013. In addition, drug-related deaths have increased and are 18 times higher in the most deprived areas when compared to the list. Can the Minister confirm what steps the Scottish Government have taken to address these health inequalities and the specific health conditions that disproportionately affect those from the most deprived areas?
Minister.
So we absolutely recognise the clear and inextricable links between health inequalities and poverty, and that's why we're using all of the powers and resources available to us to support families as far as possible and to tackle the underlying causes of inequality in our national mission to tackle child poverty. We're also, as you're aware, being on the CPGs that you're in, we're also targeting people who have low incomes in our reaching out to provide healthy, life-changing... We are also targeting people who live in poverty with means to stop smoking. Measures like the minimum unit pricing of alcohol, which was aimed at the whole population, had a particular impact on people who live in poverty. And those who live in poverty were the ones who were most helped by that policy.
Faisal Chowdhury.
I thank the Minister for that answer. For individuals with diabetics, poverty-driven health inequalities are preventing them from accessing technologies advanced in the treatment of their condition. This has been highlighted by Diabetics Scotland, Diabetics Tech Cannot Wait campaign. This technology has a potential to change and indeed save the lives of those with type 1 diabetics. It can also reduce serious complications and the strain on the NHS. Can the Minister advise what action it will take to tackle the inequalities of access to the hybrid closed-loop diabetics technology in relation to a socio-economic background?
Minister.
Absolutely, and it's a great question. Those people have real difficulty accessing healthcare and navigating healthcare. One of the reasons that people who are experiencing health inequalities suffer poorer outcomes is because the system fails to respond to them and listen to them in the way that it does for those from a wealthier and more educated background who are more able to advocate for themselves. So undoubtedly, we will be making sure that the system begins to listen to absolutely everyone. We have a whole lot of money going into, and I can write to the member with details of how much money there is going into those particular diabetic technologies. It is a tragedy that people, one of the greatest predictors of people's health and life expectancy is their wealth, and it is an absolutely brutal tragedy that this Parliament is determined to tackle, and we will tackle it, but we will need cross-party support in order to make the bold decisions that do fundamentally tackle the underlying causes of poverty, as well as ensure that people who are living in poverty can access equal